talk about Anaphylaxis Week. I'm amazed I managed to say it correctly. And Anaphylaxis Awareness Week has been this week. What is it? It's a serious allergic reaction that requires emergency treatment. It can occur when somebody's exposed to something they're allergic to, an allergen. Reactions usually begin within minutes and rapidly progress, but can occur up to 2 or 3 hours later. Now, whenever you talk about something like that, everyone goes, oh, peanuts. But it's not just that. My late father, it had bee stings were his things. But what happens if you're out and about and you don't have your EpiPen with you? You could be out playing sports. You might be at school and your satchel, you're not near it. And also, let's not forget, there is a psychological effect of fear, especially if you weren't expecting it. If there's something in some food that you ate that you weren't expecting, or 100 reasons, you can't always have something nearby in those moments of panic and fear. I met our next guest not long ago. He's somebody who had the same sorts of things and has come up with a brilliant, I guess you can call it, like there are emergency kits if somebody has a heart attack. This is for somebody who, an emergency kit for somebody who's having an anaphylaxis shock. Joining me now is the inventor of, who will tell you more about his invention in a much better way than I have, Zach Marks, who's CEO of Kitt Medical. Welcome back, Zach. And also Jane Graham, who's head nurse at Thomas Clapham Day School. And she'll explain to you a very good reason why I'm talking to both of them. Zach, let's come to you first, just for people who don't know. You, and this is what I'm always so interested in, through your own, you have an experience, what we call lived experience of what I'm talking about, don't you?
Yeah, I was diagnosed with a severe allergy to all nuts as well as a couple of legumes back when I was about 5 years old. And so I've always carried my adrenaline pens with me wherever I go.
But are there situations, for people saying, and we'll come to what you've actually invented in just a sec, but people who say, oh, you should have your pen. It's hard enough for a kid, or I'd say an adult. And then, as I said before, there is also the shock and the psychological shock factor. And you may have an attack where you can't remember, think, speak, all of those things and more, aren't there?
Yeah, absolutely. I mean, the adrenaline pens themselves are really easy to forget. They expire every 7 to 12 months. So a lot of the time people are carried expired ones, or they go out of date and they struggle to get new ones. And then, of course, you've got to remember to actually have them on you when you go out. And I run an allergy business and I have forgotten my pens every now and again. Like, it is really easy to do. And actually at university in particular, there's sort of what we see is like a drop-off point where normally parents are the ones telling their kids to take care of their allergies and get their new adrenaline pens. But as soon as you go to university, it's sort of the last thing you want to be thinking about. And naturally, everyone else sort of forgot.
Yeah, you want to be quote unquote normal, whatever that is, run with the crowd, and until it's too late. So tell us about your invention. I mean, I rather clumsily described it as like a defib kit that you might see everywhere for somebody who runs into trouble with their heart. Yours is if somebody goes into anaphylactic shock.
Yes, so we do refer to it as just like a defibrillator, but for allergies. I've actually got one.
You got one there? Hey, yeah, there you go.
I've got one on my wall and I got one here. So basically what we do is we install these in schools across the UK. They run on a subscription service. And the idea was that when I was in university, I wasn't carrying my pens. People didn't know about my allergies. The training is pretty lackluster in spaces. So what we've done is created these kits that you can just unlock with a key. And then inside them, we have 4 adrenaline pens that we run on a subscription. So we've installed these now in about 160 schools across the UK. And the idea is they're a spare set of adrenaline for people that develop new allergies, or maybe they have prescribed pens, but they've gone out of date or they've forgotten them. They've actually done some studies, and I think that was a study of about 800 people, and they found that only 50% of them were actually carrying their pens when they go out. But to be honest with you, I've got many, many friends and family members with allergies. Pretty much none of them take their pens with them. There's just so many reasons why they're easy to forget. So having this spare set can just be there in case you have an anaphylactic reaction. And we've seen it now be available to 85,000 students. And actually the first kit was actually used the other day as well. So that was amazing.
Now, just remind me, just tell me what happens if you think somebody's in shock and you gave them that and they weren't in shock? Can you overdose? I mean, I saw when you opened that kit that there were 2 different strengths.
Yeah, I can show you here actually. So we've got Jane with us, so I'm sure can explain it better from her medical background, as I am not a doctor. But essentially inside our kits, we have both doses of adrenaline. These are just trainer pens. So the actual pens themselves, when they are the correct dose, to have a red strip or a yellow strip. And that helps identify whether they are the 300 microgram dose, which is for everyone over the age of 6, really, and the 150 microgram dose, which is just less adrenaline, suitable for smaller children, really below the age of 6. But we have guidance from leading doctors who say that adrenaline isn't innately harmful. And really, in that emergency anaphylactic scenario, you're better off using the adrenaline than waiting and not using it, because the downside of something occurring can be so tragic.
Yeah, absolutely. Let's come to Jane Graham, head nurse at Thomas Clapham Day School. Jane, thank you for joining us. It's not a lot of people, I guess, even think how dangerous anaphylactic shock can be. Can you just tell us, and Zach just touched upon it, in the worst case scenario, if not treated, if somebody can't get to their pen, what are the outcomes?
Well, it's a really good question you asked there, Trisha. And actually, to help us understand this, in the UK last year, there were 25,500 admissions to hospital through anaphylaxis and allergies. And 5,000 of those were full-blown anaphylaxis. At its very worst, anaphylaxis has 3 potential life-threatening problems, one of which is to the airway, that's swelling that closes off the airway. Another problem to the breathing is an asthma-like behavior within the lungs. And the third big problem, life-threatening problem, is a cardiovascular collapse, where a person becomes very dizzy and very faint. Now, a person could have one of these, or they could have a combination of all 3. But either way, whether it's 1, 2, or 3 of these life-threatening symptoms, it has the potential for a person to die.
Wow. I mean, 25, just a number. I'm sure most people would be amazed at that. Now, again, when we talk about these allergies, everybody goes, oh, peanuts. And we heard from Zach for his walnuts. We think about nuts. What are some of the other things that can trigger this response in people?
Well, there are a wide variety of things that people are becoming more and more allergic to. And the most common ones actually are eggs and cow's milk. But it can be non-food substances such as bee stings that you were talking about.
Dad was like that,
Yes, and latex, which was the sort of originator to all this as well. You know,
really?
People started getting back in the sort of 80s and 90s. But it's more food substances that we're seeing, particularly with oral allergy syndrome, where people are becoming more allergic to the skins on fruits and vegetables, such as raw carrots.
Oh, really? Is that because of pesticides or something? Or do we know why?
They don't. There's been a lot of research into what's causing this, and I would hate to speculate on what is the most common cause for it or why. But there is a lot of research out there that implies a number of different things that it could be, but nobody's really been able to find this is the reason why we're becoming more and more anaphylactic to certain substances. It's a bit of a mystery, really.
Now, many people, when you talk about these allergies, will, as I said before, think about peanuts. And the one that you read about most is on a plane, when they ask, how close do you have to be to whatever I mean, obviously with a bee stinging you, but how close do you have to be? Is it really that nobody around can have anything like that? Or is it when it comes in contact with your skin or your tongue? When does it become dangerous to somebody who has one of these responses?
Well, this is a difficult one to answer because it's very different for each person. Everybody's sensitivity levels are different for their the things that they're allergic to. So for some people it is touch, for some people it is simply shaking hands with another person and then maybe touching their lips because that person has been in contact with, well, let's use nuts for this example. So it can be as simple as that. It could be that for other people it is the ingestion of that particular food, which may be accidental, it may be hidden in another product. So it does vary quite a bit for each person.
Just coming back to Zach, for you, what do you actually have to eat a walnut, or is it or be near somebody with a walnut? And just tell us, if you wouldn't mind, what it feels like. What happens? What's the result?
Sorry, it's actually all nuts, not walnuts.
Oh, walnuts. I beg your pardon. So, do you have to actually eat them, or is it somebody nearby? Or because people will say, they roll their eyes when they say on a plane, please, if you've got any nuts, don't eat them. And you think, well, I'm in 25C and the person with the allergy is in 1A. How can that possibly affect them? And as Jane explained to us, it's different. But for you, is it eating them, touching them? What's the actual contact, and what is the effect without your EpiPen? What happens to you?
So I originally found out I was allergic to nuts as my friend was offered peanut butter sandwich when we were about 5 years old. I instinctively hated the smell of peanuts, even though I had never eaten them. That was my body trying to tell me something. And I had butter on toast, and just the traces on that knife were enough to make me ill for about 2 days. And that's how I discovered I was allergic to nuts at 5 years old.
When you say ill, are we talking about what, vomiting or?
Yeah. I mean, honestly, you'd have to ask my mum. She's obviously going to remember it better. But
better than you do.
I do know that I was very unwell. Thankfully, not to the point of anaphylaxis where I needed adrenaline. But it was sort of the perfect way to find out I had the allergy. And from that point, I think I've avoided peanuts, but I've had various almonds and here and there once or twice where I've again been very, very ill, not needed adrenaline. So thankfully my allergy isn't anywhere near as severe as someone who might have airborne anaphylaxis, which is the term you would use for someone. They would need to make that announcement on that plane, for example.
Okay.
But
that explains it.
Like I went on a plane very, very recently, a couple months ago maybe, and someone right next to me whacked out a Snickers bar. And I genuinely, like, my heart dropped, because even though I don't have airborne anaphylaxis, it is still incredibly anxiety inducing because allergies are so unpredictable. Like, you really do not know if that skin on skin contact, or if the airborne, or if they're going to touch something that you're going to touch. Just the anxiety and the daily burden, the stigma of living with it and having someone else around it. I don't want to say, please can you not eat your Snickers bar, because I don't know what can happen to me, just in case. You can't, it's a very hard thing to broach in conversation.
That's a really good point that you make. Coming back to you, Jane, working in schools as well, it must be difficult for children who just want to hang out with their friends. And as Zach was saying before, that drop off when people go to university. But there must also be that stigma and that pressure of being seen as a wuss or whatever, fill in the blank, and not wanting to be the killjoy that can prove, well, dangerous for some kids.
Yes, and that's a really difficult thing. There has been a lot of conversations around bullying at school, people treated differently because of, having to avoid certain foods, not being able to do certain things. So there can be a culture of that, and that's why we need to educate our youngsters really well that this is a wide problem. Again, if we look at statistics, there are roughly 5 to 8% of all children proven to have allergies in schools, which if you take a group of, 2,000 children, we're looking at somewhere between 100 and 160 children that have the potential to be seriously ill. So we do need to educate them and make them aware, so that they can be sensitive to others. I did a lot of work with that in my last school, and the children were very respectful of those children who had to carry their anaphylaxis bags with them, to the point where actually if a child put it down and left it somewhere because she'd run off into the playground, they would go, "Babe, Nurse Jane, please, here's so-and-so." Anaphylaxis. So they were really, it is possible, but raising awareness and educating people about the incidences is the way forward here.
Absolutely, and that's why this week has been so great. Now, if people want to find out more information, where are good sources of that?
So there's a number of really good sources. In the UK, we've got Anaphylaxis UK, which is fantastic, resource for parents, for children, and for health professionals as well, those working in schools. There's also the BSACI website, which has really good care plans for children who have anaphylaxis, and we have a duty of care to make sure there are care plans in place for these children. They also have lots of teaching, but of course, this is why Kitt Medical is so good, because not only does it provide kits that Zach has just shown us, but they have an awful lot of education and resources on their website, which is also really good for just the lay person as well as the healthcare professionals, and training for staff, which is so important.
Brilliant. Zach, thank you so much for joining us again.